Hi everyone, it's Val from Becoming Human Again, and today I'm going to be talking about the emotional aspect of Cushing's disease. This is one of the major symptoms of this illness. I have a special guest here today who will be talking a little bit more about Cushing's and how therapy can help anxiety and depression. And here with me today is my own therapist, Dr. Al Levy. Dr. Levy, would you mind introducing yourself to the audience? And we can go ahead with the interview questions afterwards.
Thank you very much, Valerie. So, I'm Dr. Al Levy. As far as my practice is concerned, it's a clinical private practice set in Westport, Connecticut, and then I've been in private practice in the metropolitan New York area for the past almost 40 years now. So I was trained at Columbia University as a clinical social worker and went on to become a modern psychoanalyst from the Philadelphia School of Psychoanalysis, and after which I did what you might say postgraduate study in meditational techniques throughout the world that I've integrated into my private practice, and use meditative techniques instead of medication for emotional well-being and mental health. Now we're talking about Cushing's disease, and there are some very dire mental, emotional symptoms that come with Cushing's disease. And so when we want to consider them, it's important that we have the proper treatment for them in addition to the Cushing's disease itself.
Thank you very much for that explanation. So, Dr. Levy, what are some symptoms of Cushing's disease?
So from a point of view of mental and emotional health and well-being, the symptoms are anxiety, depression, ever-increasing and deepening depression, increasing anxiety over the term of the Cushing's disease itself. Left untreated, if the Cushing's disease itself is left untreated, then the emotional components of anxiety and depression increase. They can become so stressful that there's suicidal thoughts and ideology involved, of course, and that without therapeutic treatment could be catastrophic. So it's important that if a person has a diagnosis of Cushing's disease, that they seek a competent and well-qualified therapist immediately. So in addition to that, you can have memory impairment, short-term memory impairment, ultimately long-term memory impairment. If it involves the pituitary gland, because there's a tumor like either benign or malignant tumor on the pituitary gland itself, then the Cushing's disease is being caused by that because the adrenocorticotropic hormone, ACTH, is being overstimulated, overproduced, which stimulates the adrenal glands, which sit on top of the kidneys, to produce more cortisol. And it's the cortisol itself, the overproduction of the cortisol itself, which is ultimately what Cushing's disease is about, which stresses out the entire body. In addition to that, there are secondary and tertiary mental and emotional components to, of course, the increased stress itself from the disease, and all which are ultimately can be treated medically, of course, but therapeutically without medication. It's very important to take that course of action. Therapeutic treatments, clinical therapeutic treatment without medication, preferably.
Right. And I do remember that while I was having Cushing's, I just felt so anxious all the time. And remember, I told you that I always felt like I was running out of time, but for what reason, I had no idea. But I was always like in a bunch and just stressing out about so many little things that I shouldn't have even stressed out about in the first place. And I also remember being really sad and embarrassed and just I didn't know I didn't know where to put my emotions at the time. It was just like an emotional roller coaster, and there were feelings that I had inside of me that I just didn't know where it was coming from. And then once we found out that I had the tumor in my brain and that I most likely had Cushing's, it all made sense. It explained why I was so uptight all the time, and explained why I was feeling so down. I also realized that Cushing's made me kind of depressed, I'm not gonna lie. And at the time I didn't know whether I was depressed or not, but I think you kind of figured it out while we had our therapeutic sessions.
Right, that something was absolutely wrong, and it wasn't just your emotions. It wasn't just in your head, which in medical community, the first go-to is, oh, it's all in your head. And of course, we know that when your Cushing's disease was treated, the doctors were very hesitant to admit that or acknowledge that it was actually a pituitary tumor that was causing it. Even though it was about the size of a pea and turned out to be benign, it still had a devastating effect in terms of your endocrinological system. And the fact is, the adrenals were being impinged upon, overstimulated, and the cortisol that was pouring into your body was like acid that was eating you up from the inside out.
That's right. That's how I felt. And once I was referred to the neurosurgeon, Dr. Bruce, we had to do the whole testing all over again with the endocrinologist from Colombia, from his team. So that took, again, a big toll on my emotional well-being. I was stressed out. I didn't know what to think. That, okay, we're just prolonging my surgery, and when will we actually find out that I can have the surgery at all? It took months and months, and then at the end, we finally did the petrosal sinus sampling, where they drive 2 tubes from the groin all the way up into the sinus cavity, the pituitary sinus cavity, and they take samples from that cavity to make sure that the tumor is secreting the extra hormones. So that was almost as dangerous as the brain surgery itself. And I was awake the whole entire time that they did this. But I'll explain in a next video how exactly that went, and I'll show you images of that intrusion.
I'm sure that those are shocking images, and just the thought of having to have gone through that type of procedure was traumatizing in and of itself, which you had to think about for more than, it seemed, 6 months. And the delay the doctors found out, the medical doctors found out that you had a tumor, a pea-sized tumor sitting on your pituitary gland, yet they wouldn't admit that that was the cause of your Cushing's disease. Instead, they went about testing for over 10 months to determine whether that was the real cause and whether to operate on the pituitary gland's tumor.
Right. And, well, it wasn't, from once I stepped foot in Colombia, it wasn't 10 months because I was referred to Columbia University last year, 2017, November. and then I had surgery on April 18th, 2018. So it took a good 6 months or so.
6 months. But 4 months before that,
I was at the endocrinologist still, and we were doing the initial phase of the testing,
right.
which was, I wasn't expecting to have a tumor in my brain at that time. I thought it was just, I just have a hormonal imbalance, we can fix it with something. But I didn't think it would be surgery, and I had no idea that it would be a brain tumor,
So in this case, it's really important that the clinical therapist working with a person who has Cushing's disease is a proactive advocate for that person with the medical community. So in our case, I constantly urged you to go back to the doctors and tell them that this was the cause and that they needed to operate as soon as possible. And I advocated that you would advocate for yourself that way, but if necessary, I would have called the doctors. It didn't happen to be that necessary because along the way, the pace of it all, you were insisting that at the time that you needed those tests and that the doctors wanted those tests. But one thing to remember is that the doctors wanted those tests to make sure that they couldn't be sued for malpractice.
Well, right, and I do understand, because if they take out the tumor and something happens to me during the surgery, and they find out that it's not the excessive hormone secreting tumor, that something else is causing the Cushing's, then they'd be in big trouble. So that's why it took so long. They wanted to be more certain that okay, we're good to go, because honestly the tumor wasn't that big to be operated on. If it wasn't causing Cushing's, they wouldn't have touched the tumor. They would have let it grow to at least 1 centimeter in diameter, and then they would go ahead with the procedure. But if it was causing Cushing's, then certainly they have the right to take it out if it's less than 1 centimeter.
Right. So in that regard, it's a very sensitive, touch-and-go emotional, mental atmosphere in which to work with a person who has Cushing's. And it really is important that the person feels supported while they're going through that disorder. The health is deteriorating until they get proper treatment, and that's a very stressful experience in and of itself.
Yes. Dr. Levy, what would you recommend for someone with Cushing's syndrome or Cushing's disease? How should they handle their symptoms emotionally? What wouldn't you recommend them to do?
So it's very important to realize that if you're going to take medication for the disease itself, that's going to have some toxic side effects. Not that many, but nevertheless, the body's already stressed, and you add the toxic side effects of the medication in addition to the medication being effective for the relief of the syndrome, if there is such a medication, for a particular person, and that's dependent upon their individual circumstances and their doctor's recommendations, that you minimize the toxicity to the body of the medication. So if you're depressed and you're anxious and you go to a psychiatrist, they're going to say, well, you need to take this antidepressant, you need to take this serotonin uptake inhibitor, you need to do this, you need to do that, and they'll give you probably a cocktail of medications for your psychological and emotional needs. In the case of Cushing's, these will have almost no effects after a very short period of time. And the toxicity of the medication will have a detrimental effect on the body and on the Cushing's disorder or disease itself, and add to the stress components and the toxicity overload of the body itself, which then the kidneys have to work out and the liver has to work out, which they're already stressed by the high cortisol levels, and you just don't want to really do that.
Yeah.
So to deal with the depression and the anxiety and the short-term and long-term memory effects, if they are there, medication is such a better form of treatment in addition to therapy itself, talking therapy, because it basically allows the body to calm down. It helps alleviate some of the stress load. Harvard research and research at Stanford University in meditation and its effects physiologically on the human body have already demonstrated all of these things, and much, much more than that. It helps a person feel confident. It helps a person understand that they have a resource within themselves that they can sit and find some peace in the midst of their increased stress due to the high cortisol levels. So all this is extremely important to consider in the process of dealing with the emotional, mental components and symptoms of Cushing's disease.
Well, it's right, because whenever I attended your private meditation classes, I always felt so rejuvenated afterwards. I just felt so calm. Right before the meditation class, I'd feel like this, all tight and just, I don't know, even upset. I would even feel upset for no reason. And then I'd come to Dr. Levy's meditation class, and then I'd just leave like I'm walking on a cloud or something. It was great.
Well, I guess I could take this opportunity to say a little bit about meditation. Most people think, oh, I can't do it, it's so hard. Well, meditation is so easy. I've taught 5-year-olds to meditate in Haiti after the earthquakes. They slept, and 85-year-olds, and I was sent to Haiti by the government, and I was also sent to Sri Lanka after the tsunami for the same purposes of counseling and introducing meditation as a way to cope with post-traumatic stress disorder, which if it's used immediately, works extremely well. The longer you wait, the more difficult it is to get into the post-traumatic stress disorder, But meditation at any point in anyone's life is going to be helpful in dealing with post-traumatic stress disorder as well as the symptomology of anything. Now, it should always be for free. If somebody's teaching meditation for money, that's kind of fraudulent. Because meditation is as easy to teach as it is to teach somebody how to breathe from their belly instead of from their upper chest. I mean, it's that simple. If you can breathe, you can meditate. If you can follow your breath and know how to not react to your thoughts and feelings, and just when the mind wanders away, because it's the nature of the mind to wander away and think about all sorts of things, and then you just realize, come back gently, easily, and effortlessly to the point of focus, whether it be the breath or a mantra or an image, whatever the point of concentration and focus in meditation is, just to come back gently, easily, and effortlessly, and not fight the mind, and not care about the mind and what it does, and not judge it or criticize yourself for having a mind that's active, as a mind should be. So no one can ever calm down the mind as long as we're alive. It's going to be there. But you don't have to pay attention to it. You can watch it, you can observe it from a distance like we watch a movie, and realize you're not the mind. You're not your thoughts and feelings. You're not your body. You're the consciousness within that body, within the mind's experience. You are consciousness experiencing thoughts and feelings as a mind. So then, therefore, you can just let the mind go. Let the thoughts and feelings go. Whatever they do, they do. That's, who cares? And then you come back to the breath and just follow the breath. Or you can follow the breath with a mantra like so breathing in, hum breathing out. And you could do it through your heart center, as if you have a nose in the center of your chest. So your heart chakra opens, your heart center opens. And then nice things happen inside because the energy is flowing freely. It's not reacting to the mind. It's not being repressed by the mind. The emotions are now unbound. You don't have to identify with them. And the freedom and peace that comes with that is spectacular. And personally, after meditating for about 50 years, there is tremendous benefits from meditation, physiological, psychological, emotional, spiritual benefits, if you believe that there is something besides what you see is what you get, like the 5 senses, and I am one that does. And so that accumulative and expanding in your consciousness. So when it comes to a disorder like Cushing's disease, for instance, you think, I'm not really my body, so it's going to do what it does. And we're not reacting to it as much. And reacting to the body doing what it does in Cushing's disorder makes the symptoms of the disorder worse. It adds energy to it. It adds stress to it. It adds more cortisol
Right,
to
because you're
eyelashes.
concentrating on. So, okay, I just had this thought in my mind as you were explaining this. I remember thinking, why is my belly so fat? Why is it so fat? And every morning I look in the mirror and I just touch my belly and I think to myself, what's happening? Why is everything else more or less thin and only my belly is bulging? I don't understand this. And then I just kept giving it more and more concentration and energy, and it just got worse and worse. So I know next time not to do that.
So when we react to something like we condemn ourselves or react to thinking some part of us is not right and it should be right, it should be better, and I don't look right, I don't feel right, oh, I'm worried about that, there's a snowballing type of effect. And something has to come in the way of that to stop it. But when we meditate, we're not stopping it, we're just not participating in it. And so it loses energy, because what you don't participate in loses energy. What you pay attention to gets more energy and gets bigger. And we're just stepping back. Now I say that we shouldn't charge money for meditation, because all the great masters of meditation that taught me meditation, I've traveled the world 50 times in order to learn from these people, and I studied with them for decades, asked me not to charge money for meditation because it is a birthright. It's one of those birthrights that capitalism loves to step all over, and people love to make a profit from. Just like healthcare. Healthcare is a birthright. Every person born on the planet deserves to be happy and healthy. And that freedom of not being able to tie health to money should be a right of every individual on the planet, just like free education.
I agree.
And right now we're not in that mode of thinking. But I sure would like people to understand that everybody has a right to shelter, food, good health and health care, and meditation as well. To live, and an education, to live a life that just has a foundation of where to launch into living a better life and having a better career and being a free person on this planet. But that's my personal philosophy. Not everybody agrees with it.
I totally agree with what you just said. If it wasn't for the job that I actually work right now, I wouldn't have been able to afford the surgery. Thank goodness I had really good health insurance, because otherwise I would not have been able to pay for this out of pocket, ever. The surgery itself was more than $150,000.
Well, that's America, and that's the insurance and medical system in America. If you were in Europe, it would have been for free. If you were in Canada, it would have been for free. You would have been taken care of by the medical community, and even the clinical therapeutic needs, that psychological needs that needed to be addressed, you would have been having those taken care of as well. And that, I believe, is the system of healthcare that we need to move towards. Because if a person doesn't address their symptoms of Cushing's disorder, if they don't try to ease the process, even by prescription, by medical treatment, by therapeutic, clinical, psychological treatment, to deal with all the mental, emotional components, because they can't afford it, that is going to end up in catastrophe.
Why so?
Well, you know that you can get a heart attack from not untreated Cushing's disorder.
Yeah, that's actually one of the fatal symptoms, that if you don't treat your Cushing's, you can die from a massive heart attack because of the high blood pressure that the cortisol is causing.
And as well, it's cortisol. If you have too much cortisol in your blood, it acts like an acid. It just makes the organs work over time and deteriorate. It's a corrosive hormone when in excess, especially. What is the reason we have cortisol? So that we can fly away from fear, out of fear, from situations that are dangerous, or fight if we need to. their survival instinct is triggered by cortisol. But when you're always on flight or fight or freeze, because you can also freeze like a squirrel would freeze or a deer, as a human being, and you're always in that mode, that's going to end up in very poor mental health eventually, and perhaps suicide. Out of the depression and the anxiety increasing, but also physiologically, from the medical point of view, it's going to end up in organ failure.
Yikes, that's really scary.
So, yeah, if a person if you have Cushing's disorder, go to your doctor immediately and have it diagnosed properly and treated properly, please. And also seek out a very good clinical therapist, and one who preferably is not in favor of medication for psychological, emotional, mental reasons, but knows some meditational techniques and can use that instead, of course. And believe me, you can call me anytime if you would like, and I would be happy to consult for free. And my initial consultation is for free. And refer you to a doctor in your area of the country that is cognizant of this type of psychological treatment for Cushing's disorder, as well as any other disorder that they prefer not to use medication for.
Thank you very much. And just by the way, Cushing's disease is a very rare disease, so not many people may have it 100%. Maybe 10 to 13 out of 1 million. But still, if you feel that you might have Cushing's, please give Dr. Levy a call, because he'll be very happy to help. Dr. Levy, how can one contact you?
So I'm available by telephone consultation. I'm available by telehealth in mental telehealth consultation, and I'm also available through email.
Okay.
And all that information is both on my website as well as available at the end of this video.
Yes, everything will be in the description box below, so make sure to check that out and give Dr. Levy a call if you think it's necessary. So I'd like to conclude our interview today. Thank you very much for watching. Dr. Levy, thank you very much for your time.
For inviting me. And it was a pleasure working with you throughout your disorder, and I'm happy that you're very well now.
Thank you, and this is mostly thanks to Dr. Alan Levy, of course, because he guided me spiritually and emotionally throughout my Cushing's journey and post-op after the Cushing's pituitary tumor removal. And he was such a great help. I would really, really recommend him to anyone. Not just for Cushing's patients, of course, anyone. Thank you very much. Bye.
Thank you.